Well, on average, people with cystic fibrosis in Canada are living about 10 years longer than their American counterparts. After data seemed to suggest that life expectancy for CF patients in Canada was outpacing those in the States, scientists decided to take a closer look in a new study. Joining us this morning is Dr. Anne Stephenson of St. Michael's Hospital, one of the study's authors, and Erick Bauer, who was diagnosed with CF at the age of 5. Thank you both for being here today. These numbers were so surprising to me. I've worked as an ambassador with Cystic Fibrosis Canada for a few years now. My mom has a long-standing relationship as well. And this, to me, was something that we really needed to talk about today. Erick, I want to talk to you because nobody's lived with it longer than you. Were you surprised with these numbers?
That's a good question. I don't necessarily think that I was surprised. I think in a lot of ways I was a little bit disappointed. I have a lot of friends that have cystic fibrosis in the U.S., and you think of the U.S. as being the most powerful country in the world, one of the world's strongest economies, on the sort of leading edge of innovation, and it's a little upsetting that CF patients in the U.S. simply aren't getting the same standard of care as we are in Canada.
Well, let's talk about this divide, doctor. First of all, explain it to me. What is the age in Canada? What is the life expectancy in the United States?
So our study showed that in Canada, the median age of survival is about 50 years of age, whereas in the U.S., it's about 40 years of age.
I mean, that's shocking. And I know that your study wasn't aiming to sort of explain this, but do you have any sense of what could be causing this rift, this growing divide?
So we hypothesize there's three main reasons. One has to do with, obviously, the differences in healthcare. We have different systems in Canada than they do in the U.S. Another is early nutrition that was implemented in Canada in the 1970s may have an effect later on in life. That was implemented in the U.S. about 10 years later. And the third possibility is lung transplantation. So just access to lung transplant and outcomes after lung transplant may differ between the two countries.
All right, Erick, let's bring it back to your experience then. Access to healthcare. Talk to me about, and you said you have friends in the United States, talk to me about how you see that difference.
Yeah, I can't speak for those in the United States necessarily, but what I can say is that, my own personal experience has been as such. If I have a lung infection or if I am hit with a bit of a setback, I can call Anne or email the team, and I can sort of be in hospital receiving treatment within if not hours, days. And to me, that's a real critical part of my personal, medical regime, and having access to that has been so key in remaining sort of relatively healthy over the last few years. And I think to not have that is really a staggering thought.
And how important is that second factor that Anne hypothesized about early childhood diet and nutrition?
Yeah, diet's a big one. I think there's been a lot of research into how a high-fat, high-protein diet can really help patients with cystic fibrosis. I'm probably the only 31-year-old guy that you'll meet that has sort of a stash of chocolate pudding in his fridge, but it has worked well for me, and that along with sort of adherence to treatment and daily exercise has kept me relatively healthy over my life.
And we know, and we hear a lot about this, sort of the fundamental structural, institutional differences between Canadian healthcare system and the American. But are there any best practices that can be quickly and immediately exported from Canada to the United States?
I think that we have to look at that specifically in future studies. This study really didn't identify any specific things. The care for CF patients is fairly well standardized across countries overall. But I think future studies really need to look at how we're delivering care and what the differences are that might explain the gap.
And what are you hoping the implications of this study will be?
Well, I think ultimately we would like to do things to try and close that gap between Canada and the U.S., but really it's not just about improving things in the U.S. I think we have a lot to do in Canada as well. There are lots of patients every year that die of cystic fibrosis at an early age, in their 20s and in their 30s. And the median age of survival is 50, and that's still very young. So we have a lot to do here and trying to move that bar up even further.
Erick, lastly, I got to ask you, you look fit, you look trim. How do you feel?
I feel good. I think, CF is a bit of ambiguous disease in the fact that, you can't always tell when somebody is sick. And certainly I've had hard times, I've had good times, but I think, again, with the care that I receive at St. Michael's Hospital from Anne and her team, adherence to treatment, exercise, I hope to live for many more years to come.
Well, listen, we're rooting for you. We're rooting for the team at St. Michael's and for everybody fighting cystic fibrosis around the world. Thank you both for being here this morning.
Thanks very much.